आमचे एपिडेमोलॉजिस्ट, आमचे डॉक्टर आणि आमचे सगळे COs आणि डायरेक्टर DMA, डायरेक्टर हेल्थ सर्विसेस, डेंटल पासून सगळे दोन गोष्टी आशिल्ले की आज मुख्यमंत्रीन आयज डिसिजन आयज रिव्ह्यू मिटींग घेतलेली म्हणून आमच्या डिपार्टमेंट कडल्यान खंय चुका घडू नये आणि स्वच्छ भारत अभियान देशाचे प्रधानमंत्री जे डायरेक्शन दिल्ले आसा जे त्यांचे एक विचारधारा ती विचारधारा फुडें व्हरपाक म्हणून आमच्या डिपार्टमेंट्सान इन सिंक विथ द विजन ऑफ द ऑनरेबल प्रायम मिनिस्टर आणि मुख्यमंत्रीचे इन्स्ट्रक्शन दिले म्हणून आमी ती रिव्ह्यू घेतली की आमी 2 तारखेर जो कार्यक्रम करूंक जाय आनी तेजे पयलीं जे कितें आमचे प्रोग्राम्स ते कितें करूंक जाय सगळ्या लोकांक इन्वॉल्व करून हे सगळे हेजे सगळ्याचेर एक विस्तार चर्चा जाली. तेजे नंतर आमी डेंगू केसीसचे आमचे जे आसा ते डेंगू केसीचे स्ट्रिक्ट रिव्ह्यू करपाक म्हणून COसाक एक वेगळ्या तरेन हांवें सांगलेलें आसा आनी की हेल्थ ऑफिसरच्या संपर्कांत तेणी रावपाची गरज आसा आनी खंय खंय आमी पळयता की खंय आमकां एक्शन घेवपाची गरज आसा, खंय आमकां दिसता की सारकें मेंटेन जायना, खंय ती सुवेज ओवरफ्लो जाता. ह्यो सगळ्या गोष्टीक लक्षांत घेवन स्वच्छ भारत अभियान म्हणजे मनस्थितीचो एक बदल घडोवन हाडपाचो त्यो गोष्टी आनी तेज्यांतल्यान आमी जेन्ना केल्यार हे सगळ्यो गोष्टी जाग्यार येतल्यो म्हणून आमी फक्त स्वच्छ भारत अभियाना खातीर आयज मिटींग आपोवंक ना. स्वच्छ भारताचेर जे कितें आमकां गव्हर्मेंट ऑफ इंडियाच्यान आयल्या आनी जे मुख्यमंत्री रिव्ह्यू मिटींग घेतल्या त्यो आमचे डिपार्टमेंट हॅज टू लिव अप टू द एक्सपेक्टेशन्स ऑफ वॉट एवर मिटींग द चीफ मिनिस्टर इज टेकन वी टूक इट. एंड देन सेकंडली द डेंग्यू पार्ट ऑफ इट. डेंग्यू पार्टाचे आमी वी आर मॉनिटरिंग. We found that there was a spike in the month of September.
Yes, sir.
And so as a result, we have also asked them to draw up specific SOPs so that every case is properly monitored. केन्ना कितें आसता की मनशाक जोर आयलो तो मागीर हॉस्पिटलान वचना, तेका स्पायक आयलो, तेका दिसता की आपल्याक जोर आयलो आपण 2-3 दिसा उपरांत वयतलो, तेजे उपरांत त्या टायमान तेजो मागीर प्लेटलेट देंवता आनी तो केन्ना इन्क्युबेट जाला ते डेंगू आनी केन्ना तेजेर परिणाम वेगळ्या तरेन जातलो म्हणून डॉक्टरांची सगळ्यांची मिटींग घेतली की आमी एक स्ट्रिक्ट SOPs आमी दवरपाची आमकां गरज आसा आनी हे दवरल्यार ब्लड टेस्टिंग पासून सगळे आनी प्लेटलेट सगळे चॅक करपाक जाय आनी ह्यो प्लेटलेट्स हे टायम टू टायम एवरी ऑल्टरनेट डे म्हाका दिसता आमचे डॉक्टर सांगता तांकां चॅक करपाक आनी म्हणूनच आमकां वेगळ्या तरेन डेंगूचेर नियंत्रण दवरपाक म्हणून आमी आयची मिटींग आमी घेतल्या. त्याच बरोबर आमी ठरयलें की ओवरऑल आमचे जे कितें अर्बन डेव्हलपमेंट मिनिस्ट्री आहा अर्बन डेव्हलपमेंट मिनिस्ट्रीन जे कितें आमी पावलां आमी घेतल्या आनी जे पावलां घेवंक जाय ह्यो सगळ्यो एक्शन्स घेवपाक इट हॅज टू बी वेल कोऑर्डिनेटेड with the health department and it is necessary that the health department and urban ministry along with the panchayat bodies and all works in a very coordinated fashion आणि हे सगळे गोष्टी आमचे आयज आमी चर्चा केल्या. त्याच बरोबर आयज रिप्रेझेंटेटिव्हली आमचे सगळे 5 डिपार्टमेंट जे खाते म्हाजे कडेन ते 5 डिपार्टमेंटाचे सगळे ऑफिसर आशिल्ले. आयज आमकां कितें करूंक जाय, आमकां कितें कशें फुडें वचूंक जाय हे अभियाना माध्यमांनी डेंगूचे बद्दल बी आमी पूर्ण विस्तारान आमची चर्चा जाल्या. आमी परत रिव्ह्यू घेतले केसीस कशे नियंत्रणान हाडप, खंयचे एरियाज खंयचे स्पॉट्स आसा त्यो आमकां ते हॉटस्पॉट्स आसा त्यो हॉटस्पॉटाचेर योग्य तरेचे सर्वेलन्स दवरपाचो आमचो प्रयत्न आसाच. मागीर गोंयचे जनतेक हांव एकटीच विनंती तुमच्या माध्यमांतल्यान करूंक सोदता की केन्नाय जोर आयलो कितें आयलें ते रॅपीड टेस्टिंगाच्या माध्यमांतल्यान ते टेस्ट तरी करून घेवंक जाय लोकांनी. आनी जेन्ना डेंगू येता ते डेंगू लायटली घेवं नाकात कारण तेन्ना प्लेटलेट्स पडटा मागीर मनशाक मागीर ते त्रासदायक जाता फुडें and platelets they maintain करपाक जाय म्हणून proper monitoring from all HOs plus I have asked them to issue fresh SOPs and fresh guidelines to all the health officers that this is the reporting pattern. So for next next 2-3 days they will do it. They will keep me in the loop. My office will be also knowing how the graph and all is moving and which are the areas and which are the hotspots which are there. Generally see many times even media feel that fogging has to be done. Fogging is an outdated concept. It has to be looked at in a very different way and as a result of which we are doing that. But even then we told the municipalities that if somebody requires, some society requires or anybody requires fogging, then please, we have already told them we'll give them money to buy the foggers and other things whatever is required as far as the municipalities are concerned. Health department also we are aggressively taking an aggressive approach on seeing how we can manage this situation in the state of Goa. I had to address all of you because just to keep you in the loop that we are on it and we are monitoring it very minutely and we are seeing what best has to be done. That's why I said let's take a meeting of the all the chief officers along with the health department so that we work in total coordination and in this way hotspots which are hotspots.
So right now Marmara Taluka, that is Vasco area, Penguin, Chimbel area, Andoni area, these are the hotspots.
So actually South Goa and North Goa total total positive cases किती असतील?
Total positive in the month of September, that is suspected, that is NS1, that rapid kit positive, is almost around 1,392, and out of that confirmed, what we say MAC ELISA is 72, which is less than August. August it was around 3,119. So we are already on the decline. September month already we are on the decline, which will still will be seeing the decline.
What
in
about the
forthcoming
confirmed
months.
cases in August?
What are
Confirmed ELISA cases in August?
confirmed ELISA cases are showing in the August are 80.
Recovered from where the outgoes, outgoes.
That also breakup I have.
What about the recovery, sir?
Recovery as of now in our peripheral hospitals, district and the CHC and PSC, the recovery rate is high. Few slightly complicated cases which are admitted in GMC, as of now they are in the recovery phase.
Any specific
Death
guidelines?
cases?
of-
Death cases.
Internal.
Actually, GMC has reported death cases, but the scrutiny is going on already, which the data is there, and on scrutiny, what we call as death audit. Like we have to see whether they have literally per se they have died of dengue, because there are other complications which are there.
How many
Sometimes the
such
dengue
cases?
as yeah.
How many such cases being scrutinized?
GMC has given a list of almost around 16 deaths to us, which we have already scrutinized. Out of that, 5 to 6 cases are of different other reasons.
Complications.
Complications. For example, 3 or 4 cases are alcoholic, severe chronic alcoholic, which in that dengue has just come inside and the death has happened. But the confirmatory test MAC ELISA, the reports are still awaited. So on the basis of only NS1 positive, we can't confirm a case that it is because of dengue per se.
These 16 cases over a period of which period?
This is from this January till
January
till date.
Sometimes what happens, suddenly a figure gets released.
Yeah.
And everybody gets agitated. So basically we are free to, anybody wants any specific, you can talk to doctor.
All the data is being
All the doctor data is there, it is available. We are not keeping any data to ourselves. Second thing what we decided also, since all the media is here and I had not addressed this issue, is that in the town planning department we have taken a decision as far as giving all the societies and housing and old buildings beyond 20 years, that will be actually assessed. Let the societies, whoever want to take benefit. It will be a uniform policy across the state of Goa in all the areas. Nobody will decide, there will be no political interference in deciding who has to be given how much FSI. It will be this body of experts. There are going to be members like Mr. Dempo and several others we are putting in the committee so that they can decide and people will have a better quality of life. The whole idea was, if you look at a lot of societies, they are virtually in a dilapidated condition. And you look at the dilapidated condition, why should people reconcile to themselves that they are going to live in this condition only for the rest of their life? So I took a decision that in the next 30 days, all the societies and whoever, they can come and approach the department's expert committee that is there. They will immediately give permission. Whatever is required, we will finalize all this, and it is in the interest of the public. What I have told them to also check is that when you are giving higher FSI to these people, that see what is the additional benefit that person is getting. Not only the builder, but also the person who is living in the building should also get an additional benefit. So this is how we want to approach this problem. It's not a problem where you just give extra FSI to somebody who wants to build it. But the person living in that society also must get a housing society or a building complex must get some amount of benefit. They have to get benefit. He must get some additional space, additional area to live. So that is why we took this decision. Ultimately, you have to start opening up these policies. These policies, once they are opened up, it is accessible to anybody. It is not that I have to decide where you have to build a house or how big I have to build or how tall you have to build. I don't have to decide. You want to build, then you come to the department and you take your permission, pay whatever the fees are, and then you can build it.
So whatever you said is well and fine. But what happens to the facilities for this, whether it is a building
My
or a
job
house?
is to deal with town.
No, because the panchayat then doesn't take the responsibility.
My job, you're asking me a question that is not in my domain. I am making policies and virtually revisiting. You saw most of the people have accepted it very positively. And also my job is to see how to make the rules in the guidelines and regulations in the town and country planning department much more easy and much more accessible to the common man. Let him take benefit. Let him enjoy better quality of life. I think it should be opened up. Let everybody have. If they want, they can go, and if they want, if tomorrow if you have a bigger building, then you are eligible to X amount of FSI. And if it's a smaller area, then you cannot get, if you cannot leave those setbacks, then automatically you will not get those. But then he should not be at the mercy of the government or anybody to decide whether he that I should not be the person to say that no, I will allow you to build, I will not allow you to build. It's not like that. What we are saying is the policy should be an open policy. Once it's an open policy, people can go and decide and build the way they want.
सर या दिवसात तुम्ही सर
100 years old building and the structure is almost to come down. So you are looking after that.
तुम्ही एक लक्षात घ्या की हांव जेन्ना हेल्थ मिनिस्टर जाला 16 वर्सां पयलीं तेन्नाच्यान तुम्ही वेगळ्या तरेचे हेल्थाचे इन्फ्रास्ट्रक्चर करपाचो हांवें प्रयत्न केला. हांव म्हणना की 100% सगळ्यात गोष्टीन यश गावला. खुबशे गोष्टी करपाक जाय, खुबशे आमकां डॉक्टर्स घेवपाक जाय. हे इट्स अ ऑनगोईंग प्रोसेस. आता पयर कोणी तरी उल्लेख केलो की साऊथ गोवा बरोबर आहा. साऊथ गोवा डिस्ट्रिक्ट हॉस्पिटलान आमी आतां रिलायन्स फाउंडेशन कडेन आमी टाय अप करपाचो आमचो प्रयत्न चालू आहा टू हॅव टेली ICUs सो दॅट वी हॅव अ हब अँड स्पोक मॉडल. Interventions to get is very difficult, so we have to figure it out. Cath lab also, there is a proposal in the pipeline. We want to see that it is taken forward in a very aggressive manner. हे सगळ्या गोष्टी करपाक नाका शेवट केन्ना केन्ना जाता बिकॉज यू नीड मॅन पॉवर, यू नीड स्पेशलायज मॅन पॉवर. तुम्ही जे सांगता ते सारख्या जुनी बिल्डींग आहा नवी बांदपाक जाय, पण आता एक प्रोजेक्ट पणजे म्युनिसिपॅलिटीन जर ठरयले की ते दिवपाक आता नॅशनल थिएटराचे तेच आता CEO कडेन उलयता ते लोकल MLA कडेन उलोवन ते आमकां सांगतले कितें करूंक जाय ते. समजा फाल्यां जी सुद्दां बांदता मागीर तेंचे कडेन चर्चा करून काही एरिया आमी तेजे कडेन बी दवरूंक शकता, पण ते अल्टिमेटली पणजेचे बॉडीन ठरोवपाक जाय. त्या प्रमाणे आमी ते फुडें व्हरचूंक जाय बिकॉज यू हॅव गॉट अ शॉर्टेज ऑफ स्पेस इन द सिटी. यू हॅव टू फिगर इट आउट. बट येस we can, because if the TB chest hospital moves to Bambolem, then we can actually build a better, it will be in between Taligaon and Panjim, and we can have a good non-bedded facility there, with a state-of-art facility. We can do it, but multiple things that we have to see that what we have taken in hand, we complete and move forward.
District hospital recommend प्रायव्हेट हॉस्पिटलान
तुजी चुकीची समज आहा. आनी जे कोण स्टेटमेंट्स करता कित्याक हांव गोवा मॉडेलाचेर चड हांव उलयता ह्या दिसांनी आनी दिल्ली मॉडेलाचेर कोका मॉडेल म्हणून हांवें सांगलें आनी एक्चुअली रबीश मॉडेल हे लोकांक केन्ना केन्ना लागता ते न्ही. आमी कितें करया आतां लागता जाल्यार गोवा मॉडेल आनी गोंयची जनतेची सेवा करपाक म्हणून आमी हांगा बसल्या. पण तुम्ही जर दुसरे कडेन पळयल्यार मुद्दम वचून पळोवन या, तुमकां कळटलें की मुद्दम आमचें कितें चुकता म्हणून चूक दाखोवपाक म्हणून प्रूव करपाक गेल्यार दॅट्स नॉट द वे टू लूक एट इट. So basically what happened as per the patient is concerned, I phoned up immediately when I got a message from the concerned MLA, is that I phoned up the director. Everything is in black and white, it's not in just I am saying it. But कित्याक थंय ICU ची थंय आमकां स्टाफिंग करपाची गरज आहा. आमी करता, मुख्यमंत्री कडेन हांव चर्चा करून ते फुडें व्हरपाचो म्हाजो प्रयत्न आसतलो. पण त्याच बरोबर आमी त्या पेशंटाक आमी विनंती केली की शी वॉन्ट्स टू बी शिफ्टेड, द पेशंट वॉन्ट्स टू बी शिफ्टेड टू गोवा मेडिकल कॉलेज because of the ICU bed, and we would have shifted immediately. But then definitely in South Goa District Hospital, as we speak today, there is no ICU facility. And ICU facility to commission, you require interventionists, you require all the equipment and all we have got. But we need that type of staffing and specialists. Now we are doing Tata Member बरोबर आमी टाय अप केल्ले आसा. काही डॉक्टर्स आमकां थंयच्यान आमकां रेकमेंडेशन घेवन ते आयल्या. ते हांवें ऑलरेडी सेक्रेटरी हेल्थाक ऑलरेडी नोट मूव केल्या. ते सेक्रेटरी हेल्था कडेन नोट मूव करून जे डॉक्टर्स अवेलेबल आहा, जे डॉक्टर्स येवंक सोदता गोंयांत काम करपाक, मॅक्सोफेशियल सर्जरी, जे ऑन्कोलॉजिस्ट आनी ऑन्को सर्जन्स आनी तेजे भायर जे जे वेगळे फिल्डाचे ऑन्कोलॉजिस्ट येवंक सोदता. आमचे आतां 10 भुरगीं आतां नर्सीज आमी पयर टाटा मेमोरियलान धाडल्या कित्याक 10च आमकां सीट्स गावल्यो. तेजे भायर शॉर्ट कोर्सीसाचे खातीर आमी तांकां धाडटले. वेगवेगळे पोस्टाक आमकां जे धाडटा आमी धाडटा, पूण ते आमी घेवंक शकता, ते घेवपाचो आमचो प्रयत्न आसतलो. वेळ लागता मातसो. इट्स नॉट समथींग ओवरनायट टू डू. गव्हर्मेंट एज अ प्रोसिजर आनी हे सगळें करपाक इट इज नॉट इजी. हे आमी आतां ह्या स्पिडीन वयता म्हणून अटलिस्ट आमचे खुबशे गोश्टी आमी मार्गार आमी घातल्यो. पूण हे कांय गोश्टी स्पेशलिस्ट गावप, त्या तरेचे डॉक्टर्स गावप, त्या तरेचे लोक आमचे बरोबर येवंक जाय, तांकां आमी ऑन बोर्ड घेवपाक वेळ लागता.
सर एकीकडे तुम्ही म्हणताय की दिल्ली मॉडेल मध्ये दम नाही, दुसऱ्या बाजून म्हणताय की गोव्याची टीम पाठवून ते काय काम केले ते बघायची.
मी सांगितलं नाही, मी म्हटलं मीडियामधून काय टीम, आमची टीम म्हटलं नाही, मीडियामधून तुम्ही आणि 4-5 असे लोक जाऊन बघायला की बाबा गोव्यामध्ये काय चाललंय. आणि ऍक्च्युली तुम्ही बघायला गेलं की कार्डियाक फॅसिलिटी 29 सप्टेंबरला आज 29 सप्टेंबरला आम्ही वी आर गोइंग टू 3 cath lab machines we are going to commission. मग मे बी अनदर 5 days 10 days एक्स्ट्रा. आम्ही आता IVF फ्री आम्ही केलं. त्याचबरोबर टाटा मेमोरियलची OPD आम्ही स्ट्रेंथन करायचा आमचा प्रयत्न आहे. गॅस्ट्रो फॅसिलिटीज आम्हाला या महिन्यात आम्हाला कॉन्क्रीट आम्हाला येणार की कसं आम्ही ते चालवणार आहे. डॉक्टर अमित मैदेव, डॉक्टर अलवारीस यांना सगळ्यांना ऑन बोर्ड घेऊन कसं करायचं, how do you do it? And we want to do it. You understand one thing. Lot of cancers are in and around your stomach. And as a result of which today you find that even the richest person getting pancreatic cancer and several other cancers, and as a result a whole family gets destroyed if the main earning member gets this type of disease. So what we are trying to do is to see that we have a state-of-art gastro facility. You will see, I'm just waiting for them to finalize in another couple of days. I think on the PDF I had seen that one proposal has come. Once that comes, within 3 months from that day, we will make sure that 3 months from the day I and doctor finalize, we will make sure that we are able to commission this facility for the people of the state of Goa, and it will be a very professionally run facility. Now in the new super specialty hospital, what are we looking at? We are looking at, now one is Dr. Madhu Prabhu Desai is running this nephrology and other facilities. Then after that we'll have a cath lab, one for cardiac related facilities. Then we want to have the IVF. Then we have a gastro, and then latest diagnostics we want to have. Many times, lot of things are very expensive, so we need to look at various models by which we can run, and how are the models that we can run. What are the models that we want to run? I'm being very honest. Today I told you just now, any document you want, you come and see and have a look at it, because sometimes some things are there are hurdles in certain way when you want to do something, because that's how it is. And that's how you need to overcome these hurdles. You have to overcome, because many times somebody doesn't send some document from somewhere. As a result of which we have to then wait and see what their view is. So I had gone to Reliance also. I had spoken to the foundation. I had spoken to them. They are offering to support us in having this hub and spoke model and several other facilities in which they will invest with us.
What model you said?
Hub and spoke means also the peripheral areas also are covered. So basically it's not easy, when I tell you, because the state has multiple issues and multiple other departments also to take care of. It is not only one department to take care of. So as a result, my job is to first see that the super specialty hospital is fully commissioned. So the people from Goa, and a cancer hospital is made available and ready at the earliest. Same side, in the forest department also we are seeing that how do we open up. We want to come up with the latest, we want to utilize the wildlife sanctuary in the best possible way. The community is also strengthened, the people also are strengthened, economically strengthened. So we are talking, there are various activities such as organic bee farming you can have in the wildlife sanctuary area, and then we can encourage and empower the community to earn money out of it. Ultimately, what is it? Then also you find, you will be wondering that what yesterday UP Chief Minister also has made a statement on giving more money, because it's an agro-based economy, giving more money to people who are having these cattle and look after adopting these cattle. So we want to see whether such a thing or a cow reserve, whether it can be made within the wildlife sanctuary area. So I have spoken to the CP Goel, DG of Forest, to see whether these type of things happen. How can we do it? There are multiple ways of doing things and looking at things. I am talking in the periphery only of my portfolios. Then how to release, how to make policies that are very people friendly and people can access and do things. Suppose in rural Goa, you want to build a house, you want to develop something, or you want to have a bed and breakfast kind of thing, you want to extend. What is the policy that I need to bring? Last time Chief Minister and myself, we sat on the steering committee and we passed several things. As a result, is there anything more required to be tweaked? Is there something that has to be done? Is there something that will benefit the people? So when we talk about hinterland tourism also within the forest department, forest protected areas, I can't give it to any other agency. It has to be GMTC is the nodal agency, and that's the only agency that will be allowed. Otherwise, forest department will be doing it. Now you have to understand. Suppose a husband is from May. So in May, if he wants to build, I'm giving a concept. If he wants to have, he has a house. Around the house, if suppose he wants to have certain extensions, then how does he do it? Suppose that area is not settled. What is the way forward? Ultimately, even Hafiz contractor spoke to me. We have taken him on board. We have written to him. We are waiting for him to give a feedback. The unique structures, when anybody takes benefit of the regulations and a higher FSI, they will have to maintain the roof facade and everything pertaining to the Goan, the most Goan inherent characteristics of a Goan and Goan, the state of Goa, what it identifying with the state of Goa is a type of policy that we have in the pipeline of bringing. If you think that I'm going to give a higher FSI to somebody and he can build any type of building and anything, I'm not going to be allowing that. He has to give a commitment in writing, and only then we will be allowing him to take this type of benefit. So this is how we want to move forward, and this is how we want to make it more people friendly. Many times people feel X is happening. Why? You go to the remote villages today. People in the villages are asking for development. People in the south are asking for development. People want to go beyond the regional plan and ask for development. And development, we want this type of development. Today the families have grown. So if a person wants to do a development and build a house beyond a particular thing, then he has to be allowed to do it. Why should we wait for the government to take a policy decision? When the government takes a decision, and why should we put the people at the mercy of the policy making bodies like us? Instead, it should be more people friendly, where people go and buy the FSI and take it and buy it, build it. This is how you have to do it. My job is to see that within the next 6 months, so Goa will have a new Town and Country Planning Act, and we need to do it. We need to have a comprehensive 30-40 years, because the Town Planning Act was this original one was initially brought out by my father when he was down early in the 70s. Now the time has come for change. Now you look at the way the Honorable Prime Minister Narendra Modi ji also has brought in the Forest Act, so many amendments have been brought. I also tweeted the other day for infrastructure projects to make it much more easy to move forward. So basically, and several other issues I have already tweeted on that. But that is how one has to look at it. Suppose you want to build something, you should not be at the mercy of me to give you permission. You should be able to go to the department and get permission on your own. Ultimately, a common man living in the village, poor fellow doesn't know what he's doing. He is actually building his house on orchard land. How many times you going to take action over it? When you're doing a zoning plan, you need to see that all these issues are addressed. All the houses are incorporated in all this, so that he's able to live a very comfortable life without any kind of stress that whether he's zoned. Wealth has to be passed on to everybody. Wealth has to be passed on to the poor man also. A simple person also should feel empowered through the policy making of the government.
So, but why the panchayats always blame?
No, I can't comment. No.
So they always put a blame on TCP.
TCP is the only department that is technically competent to give any kind of permission. And also, second time, you find that many times the people have got contrary views to contrary things. My job is to go as per rule and regulation. I am not really worried about who's saying what is happening. Some people who are not happy with the decisions you take, but ultimately Goa has to progress. You cannot have a status quo. It has to progress. You'll agree with me that if you open up a policy and if you create a type of a vertical for a person to go there, and he is able to go and benefit out of it, and he gets benefit by a policy, and he doesn't have to be remaining at my discretion, and he can go and approach the department and take whatever benefit he wants. Like I made that policy for all the housing societies and everything. Everybody has welcomed it. There have been several editorials on it. I'm grateful to the editors for having written so much about it, because people want it to be implemented in a total spirit of what I have mentioned. And we are going to implement it. When we have got people like Mr. Dempo and Milind Ramani and several other people sitting on the board, then we must make sure that we are able to implement policies which are benefit for the people. Go and look at some societies, several, फोंड्यान वचून पळयात, मडगांव वचून पळयात, हांगा पळयात, तुम्ही पळयतले की खूब कडेन अशे पडपाक आयल्या सोसायटीज त्या सोसायटीक जर तुम्ही योग्य तरेचे तुम्ही FSI दिवंक ना, म्हाका कोणूच इंट्रस्ट दाखोवचो ना ते बांदपाक. आनी प्रत्येक मनीस तुम्ही हांगाच्या रुमान जे सगळे प्रेस मिडिया भाव आनी भयणी बसल्या, प्रत्येकाक दिसता की आमकां बी त्याच तरेचे लायफस्टायल जाय जे श्रीमंताक आनी व्हडल्या लोकांकूच लायफस्टायल कित्याक जाय, की भायल्या लोकांक तुम्ही भायले म्हणटा, कोण बिल्डर म्हणटा, कोण जाय ते नांवां दवरल्या तुम्ही, पूण त्यांकाच कित्याक बेनिफीट वचूंक जाय. गोंयचे जनतेक आनी गोंयचो तो स्थानीक जो आहा ताका बी मेळपाची गरज आहा. आनी म्हाका दिसता की हांव जो पर्यंत आहा तर म्हाजी तेच तरेची मनस्थिती आसतली, आनी ते हांव पॉलिसीचे माध्यमांतल्यान हे ओपन अप करपाक जाय. A town planning department should not be at the discretion of one man or one person or one minister who's sitting here, but in fact it should be a policy that is appreciated by the people and we take it forward.
Mr. Rane.
SOPs म्हणजे आम्ही आज त्याला डेंग्यू समज डिटेक्ट झाला, मग तुम्ही किती तासांनी त्याचं परत ब्लड टेस्ट प्लेटलेट्स टेस्ट करणार, त्याच्यानंतर तुम्ही काय करणार, काय मेडिकेशन दिलेलं आहे. समजा आता डेथ झाले ह्याच्यावर बी आम्ही रिव्ह्यू घेणार आहे ऑलरेडी रिव्ह्यू घ्यायचे आम्ही ऑलरेडी ठरवलेलं आहे. आणि हे लोकांना आम्ही काय अवेअरनेस करतो, आमच्या माध्यमातून काय कितींदा टेस्ट केले, आमच्याकडे केले टेस्ट का बाहेर केले टेस्ट, बिकॉज वी हॅव टू ऑल्सो टेक अंडरटेकिंग दॅट यू शुड कम ओनली टू आवर हॉस्पिटल टू टेक अ टेस्ट. दॅट रिझन इज बिकॉज टुमॉरो हू नोज देन वेअर अँड व्हॉट हॅज बीन डन, because we need to see that the record of the patient is maintained. In a day, if you don't take it for 2-3 days, suddenly you can find within the reasonable range what is supposed to be there, it will go much below. And if it goes to 36,000 or something, then a person can go into other complications. As a result of which, it is important for us to manage this well. That's why we had a detailed comprehensive meeting of all the departments today to see that we take this forward.
Mr. Rane, I have two questions. One TCP and one health. TCP, the new law that you're talking about within 6 months, any base work started on it already?
No, we are speaking to several people. We are seeing the best practices everywhere. And I'm going to make it very transparent. We're going to take people from different places. There are a lot of people who are not from Goa, but they have got that feeling of they stay in Goa, but they want that type of architecture and other thing to be maintained. But then how much, I asked a question to somebody, how much will I be in a position to enforce this law? You agree what I'm saying? You see, when my father was chief minister in those days, he used to come under a lot of criticism from these lobbies. Because he used to say you must have a tiled roof, you must have that type of facade. But I think time has come now to have that. Whether you want to avail of the regulations, have it. You don't want to avail of the regulation, then don't have it.
And second question is, you had spoken of a private medical college in the South Goa district.
It is a
Any
necessary.
progress?
See, I have already moved a file because to form a committee. Let the committee examine what are the best practice model. There are many models that are available in which the state governments are working. In Orissa there is a model, Assam there is a model, then you have a model in 2-3 other states there are models. So basically we need to see what is the best model that is available so that we are able to provide. See what happens, I'll tell you, South Goa District Hospital is a very huge hospital. And I need some support system to see. Without, this is nothing to do with everybody who has got DDSS, my Honorable Chief Minister's opinion that we have to go for CGHS rates. So they are working on it. So CM will take a final call on it. But my own thing is that if you do not have some partner to handhold you, it will become very difficult to run that hospital. So you cannot have a replica of a Goa Medical College or a super special hospital in South Goa. But people of South Goa expect that you should do it, and we should be doing it as a government. So it is tough sometimes, but we have to see what is the best model that will help handhold us in order to provide the best of benefits. See, when it's not about privatization, nobody is going to privatize anything. It's only the education institution that will help in supporting the existing health facilities in that particular area. Nobody is going to give that building or the facility of South Goa District Hospital to anybody. We are talking only education in a medical college to be attached to the South Goa District Hospital. Nowhere have I said privatization. Nowhere I said that I'm going to hand over the medical superintendent and the whole staff will be ours only. But then how do I handhold, and how do people of South Goa have waited for too long? We need to give this benefit to them, and we have to. I will sit with Chief Minister, and we have been talking on this for quite some time, and we'll figure it out how to take it forward. आयज म्हाका जी म्हायती आयल्या, आयज कोर्टान हियरिंग जाली आनी ऑलरेडी NTCAक बी नोटिसीस इश्यू केल्या सुप्रीम कोर्टान. NTC आनी मिनिस्ट्री ऑफ एनवायरमेंट फॉरेस्टाक ऑलरेडी नोटिसीस इश्यू केल्या. ते एक्झॅक्ट म्हाका डिटेल येवंक ना. फुडली डेट जेन्ना जातली आमकां आनी क्लॅरिटी येतली की कितें जाता.
कितें तुमचें कंटेन्शन? What is your basic contention while proposing the
when it is already in Supreme Court and the matter is being heard, it is not advisable that I say anything on that.
So
you can always diverge about the contention that the
I can't.
Forest Department has.
Can
you
you
may
update-
place something before the court की बाबा आमकां याद जाली खातीर आमी हे करतात.
ते तुमच्याकडे येतलेच न्ही. प्रेसाकडे येवचे नाजाल्यार कोणाकडे येतले ते.
Okay.
आमचें कंटेन्शन कितें, आमकां कितें जाय, कशें हे सगळे गोष्टी घडटा, कशें घडून आयले, हे सगळे गोष्टी इज ऑल इन नाव इन द सुप्रीम कोर्ट. सो लेट इट.
So can you update this? You have been given in charge of this.
No, that is nothing to do with Goa.
Sir,
No, not in Goa, but you have been given. So how do you see your?
Nothing.
So, GMCन कांयच्या वॉर्डान फॅन्स आनी ना त्या खातीर पेशंटाक त्रास जाता. तर खुबशे
आमकां मातशें कांय गोष्टीचेर थंय चेंजीस करूंक जाय. चीफ मिनिस्टर कडेन चर्चा केल्या आनी जे कडेन कितें हे करूंक जाय आमकां आनी एक फेसिलिटी मॅनेजमेंट एजन्सीज ऑन बोर्ड घेवंक जाय. म्हणजे ल्हान गोष्टी आमी तेंच्या माध्यमांतल्यान आमी करून घेवं शकता. तेजेर चर्चा चल्ल्या. खंय तरी सोल्युशन आमी काडपाचो आमचो प्रयत्न आसतलो. आसा हाऊसकीपिंग मेंटेनन्साक फेसिलिटी मेळटा जे म्हणटा
फॅन आनी
खंय तरी तुजे लॉक वयता, बाथरुमाचे मेंटेनन्स आसूं दी, तेजे कांय वेगळे तरेची एजन्सीज आहात.
काय वॉर्डान एक्स्ट्रा पेशंट घालता तांकांय मागीर प्रॉब्लेम जाता.
आयजची दिसा एक्स्ट्रा पेशंट म्हाका दिसता
142 आणि 144 वॉर्डान
मेडिसिन वॉर्डान ते आहात. ते रेग्युलर मेडिसिन वॉर्ड इज ऑलवेज ओवरलोडेड आनी म्हाका दिसना आनी खंयच्याच वॉर्डान हांवें लक्ष दवरून म्हाका रोज अपडेट येता. म्हाका दिसना थँक्यू सो मच. आणि लास्ट हांवें हे विसरलो सांगपाक तुमकां हांव सर्क्युलेट करता हे आमी इंडियाज फर्स्ट 10 TPD प्लास्टीक वेस्ट टू फ्यूल पेंडींग आशिल्ले खूब दीस. आतां तुवें ते आमी ते चालू करपाचे हांवें तांकां आपूण हाडून सांगलां की फुडल्या म्हयन्यान ऑक्टोबर 30 तारखे पयलीं ते चालू जावंक जाय.
This is that Penne project.
Perne project. I have called them, told them what I have to tell them, and I also am sending the secretary to. Secretary has already discussed with me. We are also ensuring that this starts. There is a bigger plant coming up in Varanasi. One is coming in Lucknow, but this will be very useful if it functions, works very well. So I'll just leave a picture where we'll be having about 100 collection points at different places. So it will be useful for us. If this works, it will be very good for us.
The challenge is for continuous supply of that's the challenge. Because if
challenge
the plant,
is there, but
plant
this-
stops working, then to restart it is
No, challenges
cost
are
effectiveness
no,
becomes a
no,
problem.
challenges are there only, but I think there's enough this thing available. So let him. This was actually initiated earlier. I think this is a project is pretty interesting.
2008, very old.
So it had to commission. No, our money is involved there. So we had to get it commissioned. So I've given them time till 30th, before 30th October to start it. This was actually taken at 2M. Then they had apparently suggested that we will have one more in South. But I said first you start your production, we'll observe it for a year and then we'll decide about other places.